Acetylcholine Ophthalmic is medication used in ophthalmology to constrict the pupil of the eye. The active substance in acetylcholine ophthalmic is acetylcholine, a neurotransmitter that plays a role in transmitting signals within the nervous system. Indications: acetylcholine ophthalmic is primarily used to constrict the pupil during ophthalmic procedures, including intraocular lens implantation and other eye surgeries. It helps to facilitate surgical manipulation and to prevent complications. How to use: acetylcholine ophthalmic is administered as eye drops by a healthcare professional. The dosage and administration technique will be determined by your doctor based on the specific procedure and your individual needs. Precautions: acetylcholine ophthalmic is intended for use during ophthalmic procedures only and is not for routine eye care or self-administration. Your doctor will explain the purpose of using acetylcholine ophthalmic and provide instructions on the procedure. It's important to inform a doctor about any pre-existing medical conditions and medications you are taking, as they might affect the use of acetylcholine ophthalmic. Side effects: acetylcholine ophthalmic is generally used under medical supervision during surgical procedures, and its side effects are associated with the specific context of its use. Your healthcare provider will closely monitor you for any adverse reactions during and after the procedure. Common side effects related to the use of acetylcholine ophthalmic during procedures may include pupil constipation, as intended, temporary blurred vision, eye discomfort or irritation, changes in intraocular pressure. Serious side effects are rare due to the controlled environment of use during procedures, but any unusual symptoms should be reported to a healthcare provider immediately.